Hi everyone, hope you're doing well this Friday morning. Today I'm talking about PCOS and libido. We got a few questions about this, so I'm really excited to talk about this very important topic. So I'm going to go over some of the causes that we see with low libido, and then some of the treatment options to consider, and things that you can probably work on today while walking out of here. And so I'm just going to also just pull up the questions that we got. And for those of you who don't know me, I'm Dr. Samina. I'm a naturopathic doctor. I see patients online in Ontario, Canada, and my practice basically focuses on non-PCOS, fertility, and thyroid health, but mostly PCOS women is what I see. Okay, I'm just gonna grab these questions. Okay, great. Here we go. Okay. So first things first, for one of the causes when we're thinking about low libido, we want to think about if there's any medications that can be causing the low libido. We often find that in PCOS, birth control pill is commonly recommended, and this can actually lead to low libido for some women. And this is really because there's this steady flow of hormones being put into the body, and so there isn't this nice rise in estrogen around ovulation when our libido rises in a natural cycle without birth control. So that steady flow of hormones can impact our libido throughout the month. The other thing the birth control does, depending on what type of birth control you have as well, because that can also really impact what happens to your libido. But if you have a birth control that's really helping to reduce testosterone, for some women it can actually reduce testosterone quite a bit to the point where we're not having that libido. So it could actually drive testosterone down to the point where, libido also gets affected. So birth control is one, medication we need to think of. The second medication is an antidepressant, or an SSRI. And, with PCOS, oftentimes what comes is body image issues because of weight gain, because of all the, beauty symptoms that come with it, like acne, hair loss, hirsutism, which is excessive hair growth. So it's really important to kind of figure out if it could be medications. And oftentimes people are put on an SSRI because they're feeling depressed, which is very common in PCOS as well, or an anti-anxiety medication as well. So with, these medications, it can really deplete some of our vitamins in our body, and it can one of the side effects can honestly just be, depression. And so we want to work on, kind of balancing out neurotransmitters in the body as you're taking maybe some kind of medication to help with anxiety and depression. So body image issues is the second one, but it can be due to, and then lead to using an antidepressant and cause low libido. And so another thing to consider is if there's pain during intercourse. Sometimes women do experience pain during intercourse, and this can really impact desire to even have sex, or even just the discomfort in general can really impact the experience. So one thing to consider here is seeing a pelvic floor physiotherapist. They're really, really good at helping to release and lengthen and relax the muscles that are in that pelvic floor to help with pain management if there's any pain associated to that. So that's something to consider as well. And then another thing that we often see, and that's related and sometimes comes together with PCOS, is hypothyroidism. So working on or thinking about if thyroid could be an issue, because hypothyroidism, so this is when our body isn't making enough thyroid hormone, it can actually cause low libido as well for a lot of women. So, you know, working on the thyroid in that case is really, really important. And so assessing for the thyroid, especially when you're getting any lab work, is extremely important. And then lack of regular ovulation. So if we're not like regularly ovulating, we're not making that nice amount of estrogen, you know, in that first half of the cycle around ovulation. And if we're constantly building testosterone at high levels, it can actually impact libido, because we don't have that balance between creating estrogen throughout the first half of the cycle. Estrogen also peaks right before ovulation, and estrogen is our, you know, confidence hormone. It makes us feel really good about ourselves. It makes us feel sexy. So the more estrogen we build, naturally, the better libido we're gonna have. And so if we're constantly producing this high amount of testosterone, it can impact that balance between estrogen and testosterone, and, you know, further impact our libido throughout the month. So that's something to definitely consider. And then last but not least is stress. So oftentimes when cortisol, this is our stress hormone, when it is high, it can really impact the production of hormones, because it can actually impact what's going on in the pituitary gland in our brain. And in our brain, the pituitary gland releases hormones to signal to the ovaries to produce estrogen and testosterone. So if that connection is kind of disrupted, it can impact our libido as well. So stress, I find, is probably what I typically see in practice is one of the biggest factors in terms of low libido. So if there's any stressors, if you're anxious, if you're depressed, all of these need to be worked on at the very beginning to help with libido. And, you know, cortisol comes from the adrenal glands. These are the glands that sit on top of the kidneys. And when we're in situations of high stress, if we're creating lots and lots of cortisol, it can really impact hormone production. And then also if we don't have enough cortisol, so if we're producing, you know, not a lot of cortisol, it can also impact our desire and our want. You know, if you're not making enough cortisol, you're probably, you know, really tired and exhausted all the time. And obviously if you're feeling that way, you know, libido can be plummeted because of that. So definitely want to work on stress. So when we come to, so I'm just going to recap the causes that I think are really important to consider. So medication, so birth control pills, SSRIs for antidepressants, thyroid, any thyroid issues. We talked about pain. We talked about the balance between estrogen and testosterone. And then last but not least is stress. So those are like the main things that I would be thinking of when I'm thinking of low libido. And then now in terms of treatment, so oftentimes when we're talking about medications, especially the birth control pill can actually deplete our B vitamins, which is so important when it comes to mood and energy. And so if, you know, birth control is present in the case, considering a B complex with activated form of B vitamins can be helpful to help reestablish the B vitamin status in the patient. So really important to consider any nutritional deficiencies. When it comes to using an SSRI or an antidepressant, we can often pair it with some herbs or some nutraceuticals like L-theanine to help with anxiety, or even some botanicals like passion flower and valerian root to help with anxiety and depression, and just to help with mood, and then help to eventually, potentially, if you want this, is to come off, excuse me, let me just take some of my smoothie. So eventually, if you wanted to come off the antidepressant, this could help that process along, because sometimes it can be very difficult coming off an antidepressant if you've been on it for long term as well. A lot of withdrawal symptoms that we see when we come off of an antidepressant. Okay, so that's the medications. Oh, and actually there was one herb that I actually found in the research this week that actually was showing that it can help with antidepressant-induced depression. So, sexual dysfunction. So if you're on an antidepressant and it's causing low libido, there's a herb that has been studied for this exact case, and what it is called maca root. I'm sure a lot of you have heard about maca and low libido and sexual dysfunction, and it can actually really help in that scenario if the antidepressant is the cause of the low libido. So maca is actually what they've studied and can be really beneficial in that case, which is really interesting. Okay. So we talked about B vitamins, we talked about maca, so now I want to talk about stress. Stress is a huge part of why low libido happens. So if that is at any part in your case or anybody's case, it's really important to work on stress management. So whether that's, seeing a counselor, working on nutritional deficiencies like B12, vitamin D, iron, these are very important to make sure. And also your cortisol levels, figuring out if they're high, if they're low, and working with a naturopathic doctor can help do that, help you figure that out. And when it comes to dealing with stress in terms of supplementation, there's many things we can do here in naturopathic medicine, which is great. First things first, we want to figure out if there's any nutritional deficiencies like we just talked about. It is so important to get your vitamin D checked and get the exact appropriate dose for your body, because what we do see is a lot of people are taking recommended doses, which is perfectly fine, and usually the recommended dose is 1,000 international units, but oftentimes from what I've seen, it's not enough vitamin D to actually correct a nutritional deficiency. So always get your vitamin D checked. This can help with mood, it can help with anxiety, it can help with energy, it can help with the reproductive organs. Vitamin D is actually a steroid hormone, meaning that it actually is a hormone and it can sit on hormone. It actually has hormone receptors in the reproductive system. So it can really impact our hormone health and our reproductive health. So it's incredibly important. If there's one thing you take away today, is go get your vitamin D tested and get the appropriate dose, because that can be really beneficial in terms of making sure you get enough. Here we're going into winter months in Canada, so it's actually really important to get it tested soon to make sure you have enough for the winter time. Okay, vitamin D, also omega-3. So omega-3, so fish oils are really helpful for mood. We need good healthy fats in order to create hormones, so really important in this case. In terms of stress as well, it also can help with mood, especially depression, and so really helpful for anybody who's experiencing that. And fish oils are safe to take with SSRIs as well. And then adaptogens. Adaptogens are my favorite form of really working on stress. Yes, okay, so we have one question here. So someone's asking specific test for testing vitamin D levels. It's called 25-hydroxy. That's OH, basically 25-OH vitamin D. So, and I'll type that into the comments as well for you. And typically I want to see vitamin D greater than 100 here in Canada. I'm forgetting the units off the top of my head, but I'll write the units also in the comments as well for you. Okay, so adaptogens. So these are herbs that help us to adapt to stressful situations. So when cortisol is high, it's going to bring the cortisol down, and when cortisol is low, it helps to bring the cortisol back up. We actually cycle cortisol throughout the day. It actually is higher in the morning, it peaks around noon in the afternoon, and then it slowly starts to decline towards the end of the day. So you want to have this nice cortisol curve happening in your body so that you're creating enough cortisol and you're not creating too much or too little. when cortisol is very high, we do find that, you know, herbs that are nice and calming can be really helpful, especially things like passion flower, valerian root, St. John's wort can help with depression as well. But definitely, in Avena sativa, I really like that. That one's oats. And holy basil is also a nice one. It helps with depression as well, especially if you're feeling a little bit down. That one can also stabilize cortisol. But yeah, herbs that help to bring cortisol down. And then also ashwagandha, really, really, really nice herb to help balance either high cortisol or low cortisol, and it really helps the thyroid as well. So it kind of like is one of those herbs that does everything. It also helps with energy, sleep, so it does help with stress because of the cortisol piece. It does help with anxiety. Really, really, really nice herb, especially from what we've seen in the research. It can, some people say it actually increases testosterone, but I've never seen that happen in my clinical practice. I've always seen it be pretty helpful for a lot of women. Okay, so we talked about adaptogens, and then regular ovulation. So we talked about the fact that, you know, if you're not regularly ovulating, this can really impact, and this can be, what's happening is it could be because we have too much testosterone and not enough estrogen. We need a good amount of estrogen to help us to get that urge and that desire to want to have intercourse. So if we're constantly making testosterone, you know, it can impact our female hormones. So ovulation, we need to figure out the cause. So I've done a video on this in the past, but basically if the cause is insulin resistance, we want to work on that. If it's high testosterone, we want to like bring testosterone down, and high testosterone can come from high insulin. So very complex, like kind of figuring out what to do there. But one thing that we do have in the research is myoinositol that kind of helps with bringing insulin down, bringing testosterone down, and supporting healthy ovulation in women with PCOS. And so I have a video that's going to go up on myoinositol and its benefits in the next upcoming weeks. So stay tuned for that. It's going to be put onto my YouTube channel, so we'll put it on the group as well. Okay, and then treating the thyroid. Obviously, we really want to make sure we're actually getting enough thyroid hormone. If your TSH, thyroid stimulating hormone, has been tested and it looks fine, but you still have some of the symptoms of hypothyroidism like constipation, intolerant to cold temperatures, difficulty losing weight, brain fog, memory loss, I think those are like the biggest ones, I would say. Then, you know, really figuring out and diving into a full thyroid panel, looking at free T3, free T4, maybe your anti-thyroglobulin, anti-thyroperoxidase antibodies, and reverse T3 to like see if it really could be the thyroid that could be the issue, if nothing else is really popping up for you. And so when we treat the thyroid, majority of the time when there's a thyroid issue, there's an adrenal gland issue. And remember, the adrenal glands create cortisol, our stress hormone. So if we're not treating the adrenal glands while we're treating the thyroid, our thyroid might not get, you know, the support that it needs. Another thing to really consider when it comes to any thyroid issues is iron status. Iron is so important to making sure the thyroid works well. So if your iron levels are low, it can be really important to make sure you get that up, make sure enough protein is in the diet, and so on and so forth. If you have any questions at all, please drop them in the comments below, and I will be more than happy to answer them. We do have a few questions on the chat. Yeah, so somebody's asking about birth control, so we went over that. Does spironolactone affect libido? This is a really good question. I actually don't know much about spironolactone because I don't prescribe it in practice, but from what I can understand it does is if it's decreasing testosterone, it may affect libido based on that theory, but this is just, you know, my educated guess, and I don't know the side effect profile of spironolactone. So is there a supplement or something women can take to increase libido? Yeah, we went over lots of supplements today, things to consider, but definitely anytime you take any supplements or change your supplement regimen, please, contact a healthcare professional, naturopathic doctor, somebody who's trained in this area. Okay, and so someone's asking, are there non-hormonal solutions? Yes, so we went over quite a bit of non-hormonal solutions actually. None of the things that we talked about were related to any hormones that you have to take. So hopefully this will be really helpful for you to kind of guide you in the right path of kind of figuring out where the low libido is coming from. But again, if you have any questions at all, please drop them in the comments and I'll make sure to answer them. Have a great day, everybody. Happy Friday, and I'll see you next week.